Start shortly.
Order. Christina Rees to move the motion.
Thank you, Dame Maria. It's always a pleasure to serve under your chairmanship, or should I say chairpersonship. I'm honoured to deputise for my honourable friend, the member for Gower, by reciting her excellent speech to open the debate. She was scheduled to present this petition on behalf of the Petitions Committee, but has duties elsewhere. To use a rugby analogy, Dame Maria, because as you know, my honourable friend, the member for Gower, is a rugby player, I have come off the substitutes bench to replace my honourable friend. But that's all I'm saying about rugby, having spent the train journey to Paddington this morning with lots of very happy French rugby fans who got on the train at Cardiff, still celebrating their victory over my beloved Wales yesterday. I beg to move that this House is considered e-petition 608237, relating to prescription charges for people with chronic or long-term health conditions. On the 6th of March last year, the Honourable Member for Gower opened a debate on e-petition 594390, relating to prescription charges for people aged 60 or over. And I must say that many of the issues covered then are also applicable here. I want to pay tribute to petition creator Mia, who spoke to the committee recently about her motivations behind starting it. Only in her 20s, Mia is already feeling the impact of prescription charges for medication she needs to alleviate her MS symptoms. And being diagnosed so young, with the situation as it currently is, she faces paying for her medication for decades. Following her diagnosis, Mia has become part of an extensive online community of people with long-term and chronic health conditions. The common feeling of exasperation at paying for medication inspired her to create this petition. Based on these conversations, Mia listed a number of conditions in her petitions which are not exempt from prescription charges, including MS, endometriosis, IBD, POTS, depression, anxiety, and Ehlers-Danlos syndrome. Other conditions that are not exempt and have been the subject of their own e-petitions include cystic fibrosis, sickle cell anemia, Crohn's and colitis, and not a specific condition, but rather a group of people who have undergone organ transplantation. For many of the conditions included in Mia's non-exhaustive list, there is no gold standard medication that alleviates symptoms completely. Mia spoke to me about having to try new medications often, knowing full well that they may not work, but still having to pay for the pleasure. Perhaps to rub salt in the wound, Mia was told that a potential side effect of her chemotherapy treatment for MS could be that she develops hypothyroidism. Should this happen, the hyperthyroidism would make her exempt from prescription charges. I also want to thank Dan, who the committee spoke to about his petition on behalf of organ transplant patients. Dan had a liver transplant after relying on medication since the age of 13 and spent years paying for medication that kept him alive. Now having to take medication to prevent his body rejecting the new liver and allowing him to go back to work, he still faces paying for prescriptions. The crux of the issue lies in the MedX certificate criteria. It is astonishing to me that the exemption list of conditions has not been reviewed since 1968, apart from the inclusion of cancer patients in 2009. Treatments have come on leaps and bounds since the 1960s, as has our knowledge of medical conditions that were once unknown or unspoken about. That the exemption list has not moved with the times is quite frankly baffling. The question that came up time and again during conversations about this petition was, why were the conditions on the exemption list chosen over others? This is not to say that these conditions do not belong there, and nobody the committee spoke with suggested that X condition deserved to be there over Y condition. It is rather to say on what basis were conditions chosen, what was the evidence for inclusion and exclusion. I really would appreciate any light that the Minister can shed on this. If the list was based on survivability, then thanks to decades of improved research, this is something that has improved leaps and bounds. To give an example, in 1968, children with cystic fibrosis were not expected to live into adulthood. With medication and physiotherapy, the prognosis is much different to what it was 60 years ago. However, it remains life-threatening, and those living with cystic fibrosis still face paying for the medication that keeps them alive. Research has improved our understanding of chronic and long-term health conditions over the decades, and has improved the length and quality of life for so many. Surely, it is only right that the exemption list grows with this knowledge. The UK government needs to rethink its approach to prescription charges because the consequences of them can be dire. Recently, Donna Smythman has been campaigning for free asthma inhalers following the tragic death of her 25-year-old son, Jordan. Jordan was not able to afford his inhalers, even though he questioned why he had to, given he didn't ask to have asthma. Donna has taken action because she believes that access to life-saving medication, like inhalers, should be a right, not a privilege. Research published in 2023 by the Prescription Charges Coalition found that almost 1 in 10 respondents had skipped medication as a result of the cost. Because of this, 30% of these people said they now suffer with other physical health problems. The committee spoke with Lindsay Fairbrother, a pharmacist, who had conversations with people who were not taking their medication they needed because of the cost. This was an observation also made by Ellen Schaffutl, who has done qualitative research into this subject. Her one wish for this debate was that we stress the negative impact of people foregoing medicine due to cost.
My honourable friend give way?
Of course.
I thank my honourable friend for giving way, and I think she's doing a great job of setting out some of the challenges that people with long-term conditions face. Does she share my concern that not only does this have a very damaging impact on people's own health, and she rightly says that people have a right to have those prescriptions and improve their health, but potentially it has an impact on the National Health Service, that if people are skipping their medication because they cannot afford it, they're going to end up making more trips to the GP, having more trips to accidents and emergency, and potentially more hospital stays, which are extremely expensive for the health service and, of course, have a really damaging impact on them and their families.
I thank my honourable friend for her very important intervention. And I completely agree, and I'm actually coming on to that later in my speech, but I shall pass on the honourable member, my honourable friend's support to the member for Gower and I'm sure that she will appreciate it. The UK government has stated that the revenue raised from prescription charges goes back into the NHS. However, given the cost of enforcing the list of exemptions, as well as the longer financial impact on the NHS of people foregoing medication, this argument seems to me to be a false economy. Parkinson's UK have long campaigned for change to prescription charges for the people they represent, and research published in 2018 found that scrapping the charge for people living with Parkinson's would save the NHS money. The written response from the UK government to this petition stated that those with long-term conditions could save money by utilising the Prescription Payment Certificate, the PPC. Whilst this is a good option for many, during the cost of living crisis, where people are living paycheck to paycheck, this is still too much for some. We shouldn't forget that this is somewhat of a postcode lottery, as England is the only UK nation where prescriptions are not free. When the Welsh Government abolished prescription charges in 2007, it cited evidence that some people with serious chronic conditions could not afford their prescriptions and chose to have only part of the prescription dispensed to reduce the cost. It was seen as a long-term investment in people's health, with the added bonus of being cost-effective because it prevented further complications that could arise from not taking vital medications, which would increase cost to the NHS. According to the government, 95% of items dispensed in 2023 were exempt from prescription charges, but this figure is entirely useless, given that exemptions do not apply to medicines. This figure tells us absolutely nothing about who is exempt. Perhaps the Minister could enlighten us with some statistics on this. Mia stated, whilst the response from the UK government didn't surprise her, she was still gutted by it. She didn't feel that it answered any of her concerns, and I must agree with her. Of course, if we lived in an ideal world, then England would catch up with Northern Ireland, Scotland, and Wales. Exemption lists are inherently unfair, and expanding the MedX exemption list is not a perfect solution to the cost of prescriptions, but we need to start somewhere. I would urge the Minister and the UK government to listen to the thousands who have signed petitions relating to prescription charges. The NHS is under immense pressure, but people's lives are truly on the line here. My sincere thanks, Dame Maria, on behalf of the member for Gower.
The question is that this House has considered e-petition 608237 relating to prescription charges for people with chronic or long-term health conditions. Preet Gill.
Thank you, Dame Maria, and it's a pleasure to serve under your chairship. And I thank my honourable friend, the member for Neath, for opening this debate and sharing Mia's story and her reasons for creating this petition, and I thank her for doing so. I also want to pay tribute to the more than 20,000 people who signed the petition to bring this issue to Parliament, and I hope my remarks can do justice to this very important subject. Dame Maria, as we know from the debates being held on the budget this week, this Parliament is set to be the first in modern history where living standards have dropped over its course. Faced with a crippling cost of living crisis since the government tanked the economy and sent prices soaring, people are having to make impossible choices that they would never have dreamed of having to make in the past, between eating or heating their homes, paying their rent or going into debt. Or for people with chronic conditions, as we have heard today, between paying for their medicines or foregoing other essentials. It is a shocking situation that far too many people in this country find themselves in. I think we all understand the immense challenges faced by people with chronic or long-term conditions. It is part of why the next Labour government has made it our mission to reform health and care services, to build an NHS fit for the future by improving capacity and providing it with the staff, technology and resources it needs, so that all patients get the treatment that they need where and when they need it. We will deliver 2 million more NHS appointments a year and reform primary care, so people with long-term conditions can request face-to-face appointments with a doctor of their choice, meaning better continuity of care and better outcomes for patients. Whether it is the debilitating pain faced by many people with endometriosis, Ehlers-Danlos syndrome, PCOS, the struggle of living with chronic anxiety or depression, or the fatigue and disabilities associated with conditions like multiple sclerosis or POTS. In the time I have, I can't do justice to the many daily hurdles many people living with these conditions face, but clearly being able to afford essential medications should not be one of them. I thank my honourable member for sharing some of those stories today, and I recognise that the cost of prescriptions in England, currently £9.65 per item, is a burden on many people living with chronic conditions that are not on the medical exemption list. I acknowledge the government's argument that the prescription prepayment certificate scheme can reduce this outlay, and that there are a number of exemptions from paying for prescriptions for certain demographics, including those on low incomes. However, paying up to £111.60 a year on medication is a heavy outlay for many ordinary people during a cost of living crisis. And the issue of fairness between how different conditions are treated remains. When the medical exemptions list was first drawn up in 1968, it was limited to readily identifiable permanent medical conditions that automatically called for continuous, lifelong, and in most cases, replacement therapy, without which the patient would have become seriously ill or even die. There has only been one review since then, and under the last Labour government, when cancer was rightly added to the list. Many members and our constituents have criticised the medical exemptions list as being out of date, inconsistent and arbitrary, based on patterns of illness and treatment which have changed significantly since the 1960s. Previously, when this issue was debated with regard to exemptions for cystic fibrosis, the Minister stated that we do not think it would be right in this context to look at one condition in isolation, separate from other conditions, because others would rightly argue that their condition was potentially equally deserving of an exemption if it fitted the same criteria. As the petition focuses on a range of conditions, can the Minister comment on whether they see a case for looking again at the medical exemptions list now? Could she also comment on what they know about take-up of the prepayment certificate and whether its price is a barrier to some people getting the medication that they need? And what assessment has the government made of how the addition of cancer to the medical exemptions list improved outcomes for people with cancer? And does she agree with me that no one suffering from debilitating chronic illness should be priced out of the medication that they need? At a time when the cost of living is continuing to rise, the government should consider what more they can do to support people with these essential costs. Applications to the NHS low-income scheme have surged on the government's watch, up from just over 267,700 in 2021 to 361,000 applications in 2022, a 35% rise in a year. This surely reflects the scale of the problem. It is appalling that people have been rationing their own medication simply because of cost. This, of course, isn't just a matter of fairness. Skipping medication risks costing the NHS more money in the long term and putting even more pressure on primary care if someone's health deteriorates. Indeed, last year, when looking at the impact of potentially increasing prescription charges, the government's own impact assessment raised several concerns. These included that some people towards the lower end of the income distribution may struggle to afford all their prescriptions, which can result in future health problems for the individual and a subsequent cost to the NHS. This is concerning, and I would ask the Minister what estimate she has made of the number of people in England who are currently unable to afford medicine, and what assessment she has made of the knock-on impact on NHS services which are already at breaking point. Research published by York Health Economics Consortium in 2018 found that removing prescription charges for IBD and Parkinson's alone could save the NHS up to £20 million a year. So what assessment has the Minister made of the economic case for looking at this again? Dame Maria, Labour recognises that the cost of prescriptions in England, currently £9.65 per item, is a burden on many people living with chronic conditions. prescription charges have risen 34% under this government. And with costs continuing to rise, I believe there are valid concerns about people being priced out of accessing vital medicines. And while I recognise there is a broad system of exemptions from charges, including for those on low incomes, I hope the Minister, I know she would have heard the concerns raised and the representations made by the petitioners, but no one should be forced to choose between paying for their prescription and risking their health. Thank you.
Thank you, Dame Maria. It's a pleasure to serve under your chairmanship today, and I'm very grateful to the many members of the British public and also to the Honourable Member for Neath for raising the important issues covered in the e-petition and that we're considering today. I want to really pay tribute to all of those members of the public who've written in with their stories, and I do want to set out exactly what the government's thinking is and what measures are in place to support people with the cost of prescription charges. Now, I want to absolutely express every single one of us has constituents with long-term and chronic conditions who are suffering from financial hardship. I have a number in my own South Northamptonshire constituency and have helped many to get the financial support to which they are entitled. The government is fully aware that the rise in the cost of living has been particularly severe for people who are unable to work or have had to reduce their hours. Long-term and chronic conditions impact a person's career opportunities and put them at a higher risk of becoming reliant on benefits to meet their basic needs. So I hope that colleagues will allow me to set out some facts, and I will of course be happy to take interventions. So the prescription charge, currently set at £9.65, applies to each item on a prescription form and is reviewed annually. This charge has not any link to the cost of a prescribed drug or appliance or to any of the costs associated with distributing and dispensing the service. Dame Maria, I would like to set out the extent of the exemption arrangements that are in place to provide people with free prescriptions or to limit their cost. Eligibility for free prescriptions falls principally into three broad categories based on age, income and medical condition. Some of these also provide exemption from other NHS charges, such as dental treatment. First, the age-related exemptions cover all children under 16, teenagers between 16 and 18 in full-time education, and all those aged 60 and over. Second, the income-based exemptions provide for those on a low income. Most are based on receipt of certain benefits, including universal credit. Help is also available through the NHS Low Income Scheme. And then third, with a medical exemption certificate, exemptions also apply to people with medical conditions such as epilepsy, certain types of diabetes and cancer. The certificate is valid for a period of 5 years, exempting patients from paying for any of their prescriptions. And in addition, prescriptions are also free for pregnant women and new mums with a maternity exemption certificate. So as a result of all the exemptions available, 89% of all prescription items are dispensed free of charge. But I can tell colleagues that in addition to exemptions, we also have provisions in place to cap the total cost of prescriptions to any individual. Our approach to exemptions is that it isn't right to look at specific conditions in isolation. Now, someone might well consider, as has been put forward today, that their condition is particularly deserving of an exemption and that it should therefore be added to the list of exemptions. Now, I do have the utmost sympathy for anyone who needs regular or extensive medication. So whilst I must advise colleagues that the government has no plans to extend the list of conditions that confer exemptions at this time, I do want to address some of the concerns raised by colleagues about affordability. When the medical exemptions list was introduced, it meant that around 42% of all NHS prescription items were dispensed free of charge. Now, the figure has risen to around 89% of all prescription items, and around 60% of people in England do not pay any prescription charges at all. Many people with medical conditions who are not on the list may already get free prescriptions on other grounds, because current exemptions already provide help for those on the lower incomes and the most vulnerable in society. So whilst not everyone qualifies for free NHS prescriptions, support is available to ensure their affordability for those with greater need. And of those who do pay charges, no matter how many prescriptions someone needs, they're entitled to a 12-month prescription prepayment certificate, fixing costs at £111.60 a year currently, or just over £2 a week. A prescription prepayment certificate can also be purchased to cap the cost of prescriptions for a 3-month period at a cost currently of £31.25. It's really important that all of our constituents understand that point, because certainly as Minister for Public Health and Primary Care, I do get letters from people saying that their prescription costs are high and recurring. And of course, I do want people to understand that this prepayment certificate caps that cost, and I'll say it again, at £111.60 a year, or just over £2 a week. Now, that annual certificate can be purchased through monthly instalments, and that does mean that a person can have all the prescribed items they need for just over £2 a week, providing real help for someone with a long-term or chronic condition. And as previously mentioned, the NHS Low Income Scheme provides help with prescription charges and full or partial help with other health costs. It's designed to help those who do not receive qualifying benefits for exemption from prescription charges, but who are on a low income. And it is, of course, as colleagues would expect, means tested by comparing a person's income with their requirements. Now, Dame Maria, there is no doubt that there are huge stresses and strains placed by long-term conditions on our constituents' lives and on those of their loved ones. People are living longer, which is a wonderful thing, but the truth is those extra years are not always enjoyed in good health. In England, around 26 million people have a long-term health condition that can't be cured but can be controlled with medication or other therapies. 10 million have 2 or more long-term conditions, a figure expected to increase in the coming years. And caring for people with long-term conditions already accounts for over 2/3 of the money we spend on health and social care in England, which in 2022-23 was nearly £206 billion in total. Long-term conditions can also mean reduced mobility, chronic pain, shrinking social networks, and lower mental well-being. People with multiple conditions, in particular, are more likely to have poorer health, poorer quality of life, and, of course, a higher risk of dying early. That's why we're carefully considering how to improve their outcomes in our major conditions strategy. The strategy will focus on tackling the 6 major conditions groups, which account for 60% of ill health and early death in England. Cancers, mental ill health, cardiovascular disease, including stroke and diabetes, dementia, chronic respiratory diseases, and musculoskeletal disorders. And we are determined to ensure that care is better centred around the patient, with more focus on prevention and a holistic approach to support. Turning now, Dame Maria, to some other ways in which the government is providing support, backing people with health conditions who want to work to do so, we do remain committed to bringing down the employment gap for people with long-term conditions, and we continue to support those people to start, stay, and succeed in work. That's why we're increasing work coach support in job centres for people with health conditions receiving universal credit or employment support, and boosting the number of specially trained advisors in job centres, offering advice and expertise. And once we've helped people into work, our Disability Confidence Scheme encourages employers to think differently about health and disability and to take action to address issues that employees face, as well as providing access to work grants towards the cost of working beyond standard reasonable adjustments. We don't want anybody with long-term conditions, whether there's one or several, to feel that that's it, I'm just in sort of long-term terminal decline. We want to help people to feel that they have a future and that we can help them to get that support, to get back into the workplace, to make something more of their life and to actually start to enjoy life again. And then, Dame Maria, to help with energy costs, the Energy Bill Support Scheme is delivering a £400 government discount in instalments over 6 months, helping no fewer than 29 million households with energy bills over the winter. And the energy price guarantee has been extended to April 2024, reducing typical annual household bills in Great Britain by around £3,000. Now, colleagues have pointed to the abolition of prescription charges in the devolved governments. Health is a devolved matter, and the devolved administrations have full discretion over how they spend their budgets. But looking at health in Labour-run Wales, or the outcomes for the Scottish Nationalist-run health service in Scotland, I'm glad that this government in England is making the right decision to require those who are better off to contribute to vital NHS services in England. In 2022-23, those contributions gave around 670 million in revenue to England's NHS. This income helps our NHS to maintain vital and much-needed services for all patients. 670 million is equivalent to the cost of employing around 12,500 full-time nurses and health visitors for a year in 2022-2023. So I personally support that we continue to require better off patients to contribute to their own prescription charges, whilst recognising that 89% of all prescription charges are no longer payable, and of course the support that we've provided to those with multiple conditions to be able to make that affordable for them. And so I want to thank colleagues for participating in this debate, which touches so many of our constituents, their families, friends and carers up and down the country. And I want to assure all colleagues and our constituents that every penny we get from prescription charges are reinvested into our NHS, and we will always keep support in place for those who need it the most. Thank you.
Christina Rees to wind up.
Thank you, Dame Maria. And on behalf of the Honourable Member for Gower, I'd like to thank my honourable friend for her very important intervention, the opposition spokesperson and the Minister. And I'm sure that my honourable friend, the Member for Gower, will read about this debate in Hansard with grave interest. And last of all, thank you, Dame Maria.
The question is that this House has considered e-petition 608237 relating to prescription charges for people with chronic or long-term health conditions. As many as are of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it, the ayes have it. Order, order, and the sitting stands adjourned.
The proceeding has ended. 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 The proceeding has ended.